Bismillahirrahmanirrahim. I'm Dr. Eeman, and today we're going to discuss the muscles of the flexor compartment of the forearm. Alright, so in this image you can clearly see the two compartments of the forearm. In blue you can see the flexor compartment, also known as the pronator compartment. It contains muscles which pronate the forearm. And then in brown you can see the extensor compartment, also known as the supinator compartment. The flexor compartment is also called the anterior compartment, and the extensor compartment is also called as the posterior compartment. So the flexor compartment of the forearm has muscles arranged in three layers. The outermost layer is the superficial layer. Deeper to that you have an intermediate layer, and deeper still you have the deep layer of the flexor muscles in the anterior compartment. The superficial layer of muscles in the flexor compartment is comprised of four muscles. We have the Pronator Theories, the Flexocarpi radialis muscle, the Palmaris Longus, and the Flexocarpi Ulnaris. Now, all the muscles in this superficial layer of the flexor muscles are supplied by the median nerve, except for the Flexocarpi Ulnaris, which is supplied by the ulnar nerve. So this diagram here shows the superficial layer of muscles in the anterior compartment of the forearm. You can see the Pronator Theories in yellow. Now, out of these four superficial muscles, the Pronator Theories, which forms the medial margin of the cubital fossa, is the most lateral out of these four muscles. Now, if you move further medially from the Pronator Theories, the next muscle is the Flexocarpi radialis. You can see that in green here. Now, further medial to that, in blue, you can see the third muscle in this group, which is the Palmaris longus. And finally, the most medial out of these four muscles of the superficial layer, we have the Flexocarpi ulnaris, which can be seen here in red. So let's talk about the Pronator Theories. The Pronator Theories has two heads. It has a humeral head and an ulnar head. Now, the humeral head takes its origin from the medial epicondyle of the humerus, and the ulnar head originates from the medial margin of the coronal process of the ulna. Now, insertion of the Pronator Theories is on the lateral surface of the radius, and the action is that it pronates the forearm. As we talked about the nerve supply before, all of the muscles, including the Pronator Theories in this superficial layer, are supplied by the median nerve, except the Flexocarpi ulnaris, which is supplied by the ulnar nerve. Alright, so this image shows the origin and the insertion of the Pronator Theories on the humerus, ulna, as well as the radius. Now on the top, you can see the origin of the humeral head of the Pronator Theories from the medial epicondyle of the humerus. And then again on the ulna, you can see in red the origin of the ulnar head of the Pronator Theories. So both the origins of the humeral as well as the ulnar heads are shown here in red. Now the insertion shown in blue can be seen on the shaft of the radius on its lateral side and in the middle. So this image shows you the anterior view of the Pronator Theories. As you can see, now the origin of the humeral head is quite clear here, but you can't really see the ulnar head clearly in this view, but I'll share another view soon. So you can see the origin as well as the insertion of the Pronator Theories from an anterior view. Alright, so this image shows a clearer view of the origin of both the humeral as well as the ulnar heads. So you can see the two heads of the Pronator Theories taking their origin from the humerus, as well as the ulna, and then they're both inserted into the shaft of the radius on the lateral side in the middle of the shaft. So here you can see this is a 3D image of the Pronator Theories. This is anteriorly, you can see, and again a medial side, and then posteriorly here. So this is the Pronator Theories. So the action of the Pronator Theories is that it pronates the arm. So you can see that contraction of the Pronator Theories is causing movement of the radius on top of the ulna, so that the forearm is pronated. And again, the nerve supply for the Pronator Theories is the median nerve. Now here we can see the Pronator Theories, and we know that it has two heads, a humeral head from the medial epicondyle of the humerus, and an ulnar head from the coronoid process of the ulna. Now in between these two heads of the Pronator Theories passes the median nerve, and it can get trapped in between these two nerves under various conditions. For example, if there's hypertrophy of this muscle, and it can lead to a syndrome known as the Pronator syndrome, the Pronator Theories syndrome. Here again you can see the median nerve passing from the arm across the elbow joint and into the forearm, and while entering the forearm it passes between the two heads of the Pronator Theories, and this is the site where it can get entrapped, and this can lead to the Pronator Theories syndrome. So the second muscle in the superficial layer is the Flexor Carpi Radialis muscle. It originates from the medial epicondyle of the humerus, which is the common flexor origin. The insertion is primarily into the base of the second metacarpal, but some fibers are also inserted into the third metacarpal. Now what it does is that it brings about flexion at the wrist joint as well as abduction at the wrist joint, and it is of course supplied by the median nerve like we discussed before. Alright, here you can see the origin of the Flexor Carpi Radialis from the medial epicondyle of the humerus, and the insertion into the base of the second and third metacarpals onto their palmar surfaces, the anterior surfaces of these metacarpals. So here you can see the Flexor Carpi Radialis. Now the image on the left shows you the origin of the Flexor Carpi Radialis from the medial epicondyle of the humerus, and then you can also see the insertion of the tendon of the Flexor Carpi Radialis into the bases of the second and third metacarpals here, primarily the second metacarpal bone. Now this is on the right is a posterior view of the Flexor Carpi Radialis. You can see the origin, but clearly you can't see the insertion. So the Flexor Carpi Radialis is supplied by the median nerve, and its action is to bring about flexion at the wrist joint as well as abduction at the wrist joint. So the third muscle in the superficial layer is the Palmaris Longus. Again, it originates from the common flexor origin, which is the medial epicondyle of the humerus. Now its insertion is that it is inserted into the distal part of the Flexor Retinaculum as well as the apex of the palmar aponeurosis. Now the Flexor Retinaculum is a thickening of fascia at the distal end of the forearm, and the palmar aponeurosis is a triangular aponeurosis in the palm, and I'll show you images of these two things just now. But for now, the insertion of the Palmaris Longus is into the apex of the palmar epineuritis, as well as the distal part of the Flexor Retinaculum. Now, its action is that it brings about flexion of the wrist at the wrist joint, and it also tenses the palmar epineuritis. It is supplied by the median nerve. So, this image shows the origin of the Palmaris Longus in red at the medial epicondyle of the humerus, and again you can see it actually shows the insertion with blue, but the insertion is actually into the palmar epineuritis as well as the Flexor Retinaculum. Here you can see the Palmaris Longus taking its origin from the medial epicondyle of the humerus, and in the palm you can see a triangular structure. This triangular structure is the palmar epineuritis. We'll read about it in detail when we study the hand, but for now it's important for you to remember that the insertion of the Palmaris Longus is into the apex of the palmar epineuritis. Alright, so here you can see the Palmaris Longus getting inserted into both the Flexor Retinaculum as well as the it says Flexor epineuritis here. You can call it the palmar epineuritis. So the Flexor Retinaculum is again fascia. It's a thickening of the fascia in the carpal region, right? And there are various structures which pass beneath this retinaculum, and it's quite an important structure. But in case of Palmaris Longus, it gives insertion. Now the distal part of this Flexor Retinaculum also gives insertion to the tendon of the Palmaris Longus, and again into the insertion is also into the apex of the palmar epineuritis. Again you can see the Palmaris Longus inserting into the palmar epineuritis here. So if you pinch your little finger and your thumb tightly and slightly flex your wrist, you can see the tendon of the Palmaris Longus, which can be seen here. The arrow shows where you can see the tendon of the Palmaris Longus. So the next muscle in the superficial layer of these muscles of the flexor compartment is the Flexocarpi ulnaris. Now the Flexocarpi ulnaris also has two heads. It has a humeral head and an ulnar head. The humeral head again takes its origin from the medial epicondyle of the humerus. The ulnar head originates from the olecranon as well as the posterior border of the ulna. Now the insertion of the Flexocarpi ulnaris is into the pisiform bone, the hook of hamate, and the fifth metacarpal. Now the fifth metacarpal, is the metacarpal towards the little finger. So from first to fifth, when we go from the first to fifth digit, the first is the thumb and the fifth digit is the little finger. Alright, so it goes and gets inserted into the base of the fifth metacarpal bone. Along with that, the two bones, the pisiform and the hamate bone, are carpal bones. And of course, this is not part of the curriculum for now because we haven't yet studied the hand, but we'll of course read it in detail when we do these carpal bones. And so these pisiform and hamate are two carpal bones, and hook of hamate is a hook-like extension on the hamate bone. So this is the insertion of the Flexocarpi ulnaris. It goes and gets inserted into the pisiform, the hook of hamate, and the fifth metacarpal bone. Now the Flexocarpi ulnaris is the only muscle in this superficial layer, which is supplied by the ulnar nerve, and it is also the only muscle in the entire anterior compartment, entire flexor compartment, which is exclusively supplied by the ulnar nerve. There's only one other muscle which is partially supplied by the ulnar nerve, which is the flexor digitorum profundus. The only muscle which is exclusively supplied by the ulnar nerve is the flexor carpi ulnaris. Now, the flexor carpi ulnaris brings about flexion at the wrist joint as well as adduction at the wrist joint. Alright, so this image shows the origin of the flexor carpi ulnaris as well as its insertion. Now here you can see, now this is a medial view, and you can see the origin of the flexor carpi ulnaris from the medial epicondyle of the humerus, as well as the posteriorly from the olecranon, as well as the posterior border of the ulna. Now here you can see the three dots in blue on the bones in the hand show you the insertion of the flexor carpi ulnaris. I'll show you these images in a bit more in a much better view. So this is a posterior view which only shows you the origin of the flexor carpi ulnaris, and again from the medial epicondyle you have the origin of the humeral head, and then posterior aspect of the olecranon as well as the posterior border is giving origin to the ulnar head of the flexor carpi ulnaris. Okay, so this figure shows the insertion of the flexor carpi ulnaris. Now this is a close-up view which shows you the insertion into the fifth metacarpal bone, the base of the fifth metacarpal bone, along with the pisiform bone would be here, and the other one is the hook of hamate. Okay, so this is the insertion of the flexor carpi ulnaris. So a medial view of the flexor carpi ulnaris showing you taking its origin from the humerus and the ulna, and then the tendon of the flexor carpi ulnaris being inserted into the bones of the hand, the metacarpal, the fifth metacarpal, and the pisiform and the hook of hamate. Alright, so this close-up view shows you the insertion of the flexor carpi ulnaris. The P represents the pisiform bone, the H shows you the hook of hamate, and the M in green shows you the fifth metacarpal bone. So this is the insertion of the flexor carpi ulnaris muscle. The flexor carpi ulnaris is innervated by the ulnar nerve. Its action is that it flexes and adducts the hand at the wrist joint. Now here you can only see the adduction part of its action. So this is adduction of the hand at the wrist joint by the flexor carpi ulnaris. After that, we have the next layer of muscle in the anterior compartment or the flexor compartment of the forearm. Now this is the intermediate or the middle layer of muscles. This layer contains only one muscle, which is the flexor digitorum superficialis muscle. Alright, so when it comes to the flexor digitorum superficialis, this again has two heads. It has a humero-ulnar head and it has a radial head. Now the humero-ulnar head originates from the medial epicondyle and the coronoid process. So it has its origin from both the humerus and the ulna, and hence the name the humero-ulnar head. This is one head of the flexor digitorum superficialis. The other head is the radial head, and this originates from the anterior oblique line on the radius. When it comes to insertion of the flexor digitorum superficialis, the insertion is into the shafts of the middle phalanges of the medial 4 digits. So the second, third fourth and fifth digits, the shafts of the middle phalanges of these digits get the insertion of the tendons of the flexor digitorum superficialis. The action is mainly flexion at the proximal interphalangeal joint and as well as the flexion at the metacarpophalangeal joints. And then it is also supplied by the median nerve. In this figure, we can see the origin and the insertion of the flexor digitorum superficialis. Now, the arrows 1, 2, and 3 show you the various sites of origin of the flexor digitorum superficialis. 1 is the medial epicondyle of the humerus, and 2 is the coronoid process of the ulna. So, from 1 and 2 is the origin of the humero-ulnar head of the flexor digitorum superficialis, and then 3 shows you the anterior oblique line on the shaft of the radius. This is the origin of the radial head of the flexor digitorum superficialis, and then the arrow in blue shows you the insertion of the split tendons of the flexor digitorum superficialis, and it is inserted into the shafts of the second, third, fourth, and fifth digits. Here you can see the flexor digitorum superficialis muscle. You can see the origin of the humero-ulnar head. You can see the origin of the radial head from the radius, and then you can see that the muscle splits into 4 tendons, and these long thin tendons then travel into the hand, across the wrist, into the hand, and once they reach the digits, each tendon then further splits into 2, and these 2 then get inserted into the middle phalanx of the second, third, fourth, and fifth digits. A close-up view of the humero-ulnar and the radial heads, and again another close-up view of the 4 tendons of the flexor digitorum superficialis splitting into 2 each, and then getting inserted into the middle phalanges. Flexor digitorum superficialis is supplied by the median nerve. Now, its action is that it flexes the middle phalanges at the proximal interphalangeal joints. Now, this is only for the second, third, fourth, and fifth digits. It does not act on the thumb. Now, when it acts more strongly, it also flexes the proximal phalanges at the metacarpophalangeal joints. So here you can see the action of the flexor digitorum superficialis muscle. Moving on to the third layer, which is the deep layer of muscles in the flexor compartment of the forearm. This layer consists of 3 muscles: the flexor digitorum profundus, the flexor Palmaris Longus muscle, and the Pronator Quadratus muscle. So let's talk about the flexor digitorum profundus first of all. Now this muscle takes its origin from the upper or the proximal 3/4 of the anterior and medial surface of the ulna, along with the interosseous membrane. Now the insertion is into the bases of the distal phalanges of the medial forefingers. Now the flexor digitorum profundus can be divided into 2 parts based on the innervation. So the medial part, which gives insertion to the bases of the 4th and 5th digits, is supplied by the ulnar nerve, and the lateral part, which is inserted into the bases of the 2nd and 3rd digits, the bases of the distal phalanges of the 2nd and 3rd digits, it is supplied by the anterior interosseous nerve, which is a branch of the median nerve. So the flexor digitorum profundus is supplied in part by the ulnar nerve and partly by the median nerve. Now the action of the flexor digitorum profundus is to bring about flexion at the distal interphalangeal joints. Now because there is going to be a flexion at the distal interphalangeal joint, subsequently there is also flexion at the metacarpophalangeal joints, the proximal interphalangeal joints, as well as the wrist joint. This is an image showing you the flexor digitorum profundus muscle. Now the muscles in the deep layer of this anterior or flexor compartment do not take origin from the common flexor origin, which is the medial epicondyle of the humerus. So they do not cross the elbow joint. Now here you can see that the flexor digitorum profundus is originating from the anterior surface, the anterior 3/4 along with the medial surface of the ulna. Now it does not show the interosseous membrane here, but the nearby interosseous membrane also gives the adjacent interosseous membrane also gives attachment to the flexor digitorum profundus. Now you can also see here that the tendons of flexor digitorum profundus they travel all across these phalanges and then go and get inserted into the base of the distal phalanges of the 2nd, 3rd, 4th and 5th digits. Okay, so when we talk about the insertion of the tendons of the flexor digitorum superficialis and the flexor digitorum profundus muscles, it's important to understand exactly how these tendons take their insertion. So in red here you can see the tendon of the flexor digitorum superficialis muscle. Now we know that there are 4 tendons which take their insertion into the 2nd, 3rd, 4th and 5th digits, but I've only shown you one here. So each tendon then splits up into 2 and gets inserted on either side of the shaft of the middle phalanx. Okay, so this is going to happen with the tendons of the 2nd, 4th and 5th digits as well. Now the tendons for the flexor digitorum profundus muscle, they travel beneath these flexor digitorum superficialis tendons, and the tendons for both superficialis and profundus travel in a common synovial sheath. Now these tendons, the profundus tendons, then pass in between the 2 split tendons of the superficialis. Okay, so the space in between the split tendon of the superficialis, the flexor digitorum profundus tendon passes in between this space and then travels all the way to the distal phalanx here, and that then this gets inserted into the base of the distal phalanx of 2nd, 3rd, 4th and 5th digits. So here you can see the tendons of the superficialis as well as profundus in their common synovial sheath. Now they pass beneath the flexor retinaculum, and then these tendon in the hand, these 4 tendons, then for the superficialis they split up into 2 and get inserted into the base of into the sides of the shaft of the middle phalanx, as you can see here. And in the middle you can see the flexor digitorum profundus tendon, which is going all the way to the distal phalanx, and that gets inserted into the base of the distal phalanx. Alright, here you can see a side view. Now for now just concentrate on the FDS and the FDP. Okay, FDS is the flexor digitorum superficialis and FDP stands for the flexor digitorum profundus. Now you can see how the FDS or the superficialis tendon is split in the middle, and through that gap in between the 2 split parts you can see the flexor digitorum profundus tendon passing through, and initially it is underneath the tendon of the superficialis, and after the superficialis gets inserted into the middle phalanx, the profundus tendon travels all the way to the distal phalanx and gets inserted into the base. So when it comes to the action of the flexor digitorum profundus muscle, its action is that because the flexor digitorum profundus is inserted into the base of the distal phalanx of the medial forefingers, it primarily brings about flexion at the distal interphalangeal joints. Now that is the main action. After that, secondarily, if there is a forceful flexion, of course it's going to cause flexion at the proximal interphalangeal joints as well as the metacarpophalangeal joints. Now when it comes to the nerve supply of the flexor digitorum profundus, the medial part of the flexor digitorum profundus is supplied by the ulnar nerve, and the lateral part of the flexor digitorum profundus is supplied by the anterior interosseous nerve, which arises from the medial nerve. Okay, so the next muscle in the deep layer of the anterior compartment is the flexor pollicis longus muscle. Now the word pollicis is a Latin word which means of the thumb. Okay, so whenever the word pollicis is used, it means that is related to the thumb. Okay, now the flexor pollicis longus originates from the upper 3/4 of the anterior surface of the radius along with the adjacent part of the interosseous membrane. Now the insertion of this muscle is into the base of the distal phalanx of the thumb. Okay, now flexor pollicis longus is supplied by the anterior interosseous nerve, which is a branch of the medial nerve. The action of the flexor pollicis longus is that it brings about flexion at the interphalangeal joint, and since there are only two phalanges in the first digit or the thumb, so there's only one interphalangeal joint. There is no proximal or distal interphalangeal joint, and it also brings about flexion at the metacarpophalangeal joint. So here you can see that the yellow arrow is pointing towards the origin of the flexor digitorum profundus muscle, and the orange arrow is pointing towards the origin of the flexor pollicis longus muscle. Now here you can see that along with the bones, the origin is also from the adjacent interosseous membrane. So the interosseous membrane, along with providing strength and support and to the two bones and binding them together strongly, the interosseous membrane also gives an added surface area for the attachment of the various muscles of the forearm. Here you can see the flexor pollicis longus originating from the anterior surface of the radius. It does not show the interosseous membrane here, but you can see the tendon of the flexor pollicis longus going all the way down to the base of the distal phalanx of the thumb. Again in green you can see the flexor pollicis longus. Next to that you have the flexor digitorum profundus, and both of these muscles are going to get inserted into the bases of the distal phalanges. Flexor pollicis longus, which is shown in green, gets inserted into the base of the distal phalanx of the first digit, and the flexor digitorum profundus tendons go and get inserted into the base of the medial 4 digits. Alright, when it comes to the action of the flexor pollicis longus, you can see here clearly that the contraction of the flexor pollicis longus brings about flexion at the interphalangeal joint as well as the metacarpophalangeal joints. The flexor pollicis longus is supplied by the anterior interosseous nerve, which is a branch of the median nerve. So the third muscle in the deep layer is the Pronator Quadratus. The Pronator Quadratus originates from the oblique ridge on the anterior surface of the lower quarter of ulna, and the insertion of the Pronator Quadratus is onto the anterior surface of the lower quarter, lower 1/4 of the radius, as well as the triangular area which is just above the ulnar notch. Now, the Pronator Quadratus again is supplied by the anterior interosseous branch of the median nerve. The action of the Pronator Quadratus is that it brings about the pronation of the forearm at the radioulnar joints, along with binding the radius and the ulna together. So in this image you can see the origin of the Pronator Quadratus in red, and the insertion of the Pronator Quadratus. It is a small quadrangular muscle, and it gets inserted into the distal quarter of the anterior surface of the radius, which can be seen here in blue. So this is the Pronator Quadratus. Now the name suggests it's a pronator, and quadratus means it's a quadrangular muscle. So this is primarily responsible for bringing about the pronation of the forearm at the radioulnar joints, and it is supplied by the anterior interosseous nerve, which is a branch of the median nerve. Now here you can see the action of the Pronator Quadratus. Once it contracts, it moves the radius, rotates the radius on the ulna, and brings about pronation. Now here you can see a gap between the two bones where the radioulnar joint, the distal radioulnar joint should be, which is not so. It's not that far away, but this is primarily to show you the action of the Pronator Quadratus. Okay, so here you can see the flexor muscles of the forearm. Now this says that there are two layers, the superficial and the deep layers, but and that may be seen in some texts, but for our academic purposes we divide the flexor muscles into three layers: the superficial, the intermediate, and the deep layers. All right, so on the left you can see the superficial layer and the four muscles going from lateral to medial. You have in blue the Pronator Theories, in yellow the Flexor Radialis, in green the Palmaris Longus, and then in orange you can see the Flexocarpi Elnaris. Now next to that you can see the intermediate layer. The single muscle in that layer is the Flexor Digitorum Superficialis. And then further right you can see the deep layer, which consists of three muscles. The Flexor Pollicis Longus can be seen in dark blue, and the Flexor Digitorum Profundus in a lighter blue. And again another muscle of the deep layer, which you can see in purple here, is the Pronator Quadratus. Okay, so a quick review of the various layers of muscles in the anterior compartment of the forearm. Here we have the radius and the ulna articulating with the humerus at the elbow joint, as can be seen here. Then you can see the radius and the ulna articulating with the carpal bones at the wrist joint, and the relationship of these two bones at the proximal and the distal radioulnar joints. So let's review the muscle layers from the deeper layer to the more superficial layers. Okay, so let's start adding the layer of muscles. So here you can see the Pronator Quadratus. This in green is the Pronator Quadratus. Now this is the part of the deep layer of muscles, and adding, so again this is also the deep layer of muscles. In green you can see the Flexor Digitorum Profundus. Now the tendons of the Flexor Digitorum Profundus are going all the way down to the distal phalanges. Now here you can see that they're not exactly at the bases, but you know that they actually don't go and get inserted into the shaft, but in fact get inserted into the base of the distal phalanges of the medial 4 digits. Now this one here is the Flexor Pollicis Longus, and this is again the tendon of the Flexor Pollicis Longus is going and getting inserted into the base of the distal phalanx of the thumb. All right. Okay, now let's add another layer. This is the Flexor Digitorum Superficialis. Okay, and you can see the origin, the humeral origin ulna you can't see, but you can also see the radial head originating from the radius, and then you can see the tendons splitting into two and then going and getting inserted into the shaft of the middle phalanx of the 2nd, 3rd, 4th and 5th digit. And you can see the Pronator Quadratus tendon, the Digitorum Profundus tendon passing in between the tendons of the Flexor Digitorum Superficialis and the Profundus, passing between these two split tendons and getting inserted on the distal phalanges. Okay, so in green you can see the Pronator Theories. This one here is the Flexocarpi Radialis, and then this is the Palmaris Longus, and then you can see the most medial is the Flexocarpi Elnaris muscle. Okay, so these are the 3 layers of muscles in the anterior compartment of the forearm.